Guys, Dr. Brian Anderson here. We are in the middle of the COVID crisis, so not wearing the suit and tie today, but I want to talk to you about Melanotan 2. So number 2, yes, there was a Melanotan 1, and now for years there's been a Melanotan 2. What is Melanotan 2? Well, Melanotan 2 is a peptide that's typically injected just beneath the surface of the skin, and what it does is help melanocytes function more efficiently and produce more melanin. And so melanin is responsible for your skin pigmentation. And so a lot of people are using Melanotan 2 due to its sun protective effects. So some people use it for that nice tan look, which is attractive to most, but a lot of people are actually using it as well for sun protection. So especially if you are running or if you're outside, you're going to the pool, the lake, the beach, you're on vacation, what have you, as you may be well aware of, is the application of sunscreen, and keeping sunscreen on can be problematic. The greasy sensation, the number of times you have to apply it if you're exercising, sunscreen getting into the eyes. If you have no hair on your head like myself, you know that the scalp is especially prone to burning, or the shoulders or the upper chest. So having accelerated aging due to sun exposure in those areas is probably not what most of you would want. So Melanotan 2 has been effective. It's been labeled as a tanning drug. And so what I would encourage you to do is beware of some Melanotan 2 products that are sold online from China especially. There's a lot of fake products. There's products without the actual Melanotan 2 molecule in it. There are products with Melanotan 2 and other things in that product that are not helpful, possibly harmful. So definitely make sure that if you decide that Melanotan 2 is something that would be of benefit to you, that you're getting it from an approved pharmacy and a licensed physician, more importantly. So as far as Melanotan 2 benefits, obviously accelerated tanning for a lot of folks, some potential benefit of skin cancer protection, potentially. As far as things that we see that may not be advantageous, about 20% of the patients or so will develop a little bit of nausea with taking the drug. That's very common. The other thing is, if you have a lot of moles that are light, it can actually darken those moles permanently. So that may not be something that a lot of you would want. If you have questions about Melanotan 2, how it works, its effectiveness, etc., feel free to comment below, give the office a call. I'll be happy to help you in any way that I can. Most of the time when starting Melanotan 2, for the first 2 weeks, the dosages will vary, and so that dosage variance will depend on how dark you want to be. And then after that 2 weeks, you go into what's called a maintenance phase. So generally, you would do an injection every 1 to 2 weeks to maintain that level of tanness following. So Melanotan 2 has also been hypothesized to help with some sexual health, sexual function receptors in the brain as well, of note. So if you have any questions, again, call the office, comment below. Please like and subscribe to the channel. I really appreciate that. And my goal is to get out helpful information to you. Lastly, if you are interested in scheduling a consultation, give us a call. We'll get you right in. I hope that you are doing well. Enjoy the lockdown. Hopefully we're out of this crisis soon and back to our usual lives. Until next time, signing off. Thank you.